Broadly speaking, there are two treatment arms. The first line would be medication, which I'll talk about in some detail, and the second line would be ADHD coaching, which can be covered by some of our other videos by our ADHD coaches. With regards to medication, there are two main classes of medication. National guidance by the NICE guidelines recommends that we would start with a stimulant medication initially. And if patients found that they were having perhaps some side effects from that and were to try something different, there is also non-stimulant medication. With regards to stimulant medications primarily work by increasing the level of two neurotransmitters which are found to be at lower levels in patients with ADHD at the level of the brain. In particular, dopamine and noradrenaline. Stimulant medications primarily work by increasing the reuptake of these neurotransmitters as well as preventing their breakdown, thereby overall increasing the concentrations in the brain. This would lead to an improvement in a multitude of symptoms, such as an improvement in attention and concentration, an improvement in productivity. For example, when we're treating university students, they've commented that they're able to sustain periods of attention and concentration in their studies for longer periods. People who are working find that they become less distractible and are able to complete tasks and procrastinate less. There should also be an improvement in symptoms of hyperactivity. So one would feel less physically restless and feel an internal sense of emotional well-being and calmer. There would also be an improvement in impulsivity symptoms. So a reduction in a feeling of impatience, perhaps reduced spontaneous financial spending, which some patients find. With regards to the stimulant medications, there are two broad classes. One is methylphenidate and the other are amphetamine-based stimulants. And within those, there are two types. One is extended release or long-acting medications, which you take in the morning, which last till the evening. And the others are short-acting or immediate release medications. And these are given in accordance to how patients respond to the medication. And if they have any side effects, then your treatment would be tailored accordingly. Apart from stimulant medication, there are also non-stimulants, namely atomoxetine, as an example, which works by primarily increasing your noradrenaline levels. Atomoxetine is a more slower acting medication. You would expect to see symptom improvement over a period of 2 months. And then beyond atomoxetine, there are other classes of medication, for example, specific types of antidepressants, which increase your dopamine and noradrenaline levels and may help with symptoms of depression and anxiety, such as bupropion, and other treatments such as guanfacine, which is more commonly used in children with ADHD. And there are other medications such as melatonin, which can help with sleep.